In this video, I will be talking about how to identify cardiomegaly in a chest X-ray PA view. Cardiomegaly means the cardiac shadow is enlarged. The cardiac shallot is also known as shadow. Okay, the enlarged cardiac shadow. Okay, so why PA view? Because it is always taken in PA view. Okay, for determination of the cardiomegaly, PA view is taken. Because in AP view, there is apparent cardiomegaly seen. So for finding the cardiomegaly, we have to first assess the cardiothoracic ratio. So what is the cardiothoracic ratio? For that, let's look into the X-ray. We have to first see what are the normal structure that we see in X-ray. Okay, this is the trachea. Okay, this radiolucent area, this is the trachea. This is the cardiac shadow. Obviously, you can see, and we can easily see that there is an quite enlarged. Okay, so we have to first assume a midline or draw a midline, and we have to find the maximum length on each side of the cardiac shadow. This is the maximum length to the right of the patient, because our left is patient's right or the subject right, and our right side is the patient's left side. Okay, in the right side of the patient, this is the highest or maximum length of cardiac shadow, and on the left side this is the max point, this is the maximum point. So this is the maximum length of cardiac shadow, we call it B, and this angle is the costophrenic angle, right? Costophrenic angle. We find the maximum width of the thorax, we call it C. So when the cardiothoracic ratio, that is the cardiac size by the thorax, cardiac size by the size of thorax, which is A plus B by C. If A plus B by C is more than 50%, we call it cardiomegaly, right? In case of children, it is more than 55%, or the ratio is more than 0.55. In case of infant, it is more than 60%, or the ratio more than 0.6. Okay, so if the ratio is more than 0.6 in case of infant, we call it there is cardiomegaly. So what are the causes of cardiomegaly? The important causes are hypertension, which can lead to left ventricular hypertrophy. Second can be like pericardial effusion. Then cardiac tamponade. Then comes cardiac myopathy, cardiomyopathies, which contains hypertrophic cardiomyopathy, dilated cardiomyopathies, right? So these are the few examples. There are so many other you can search up in the internet. This is just for explanation purpose, right? See, this is an example of pericardial effusion. This is a clear-cut cardiomegaly. If we, this is the maximum length on both sides of the cardiac shadow, A and B. If we assume this to be the midline, right, and this is the maximum, this is the maximum thoracic width, C. clearly A plus B by C is more than 50%. There is a CT ratio. So we can call this as an example. This is a clear-cut cardiomegaly, and the shape is, see, the shape is water bottle heart, right? It looks like a bottle of water bottle heart. So it is an example of pericardial effusion.